Brought to you by GTA. We start with you.
This is the chart Dr. Cabrera points to. It tracks the projected peak of COVID hospitalizations, which typically occurs 10 to 15 days after people are ordered to stay home or when the mobility rate drops below 80%. What worries him is that the chart shows us trending above what they first thought was a plausible worst-case scenario.
Basically, we're targeting hopefully no later than Friday, the 4th of September, to be the peak for hospitalizations. And it's hard to say where in the curve it may end up. The rest of the trajectory may start following the green, but right now all signs are saying that it's going to be following the red line. And so, of course, this is a major concern, and contingencies are continuing to be made to take care of patients without compromising, standard of care as much as possible.
And if the hospitalization trajectory does track along the red line, that spells big problems, not only for facility capacity, but also the nurse and medical staff needed to run them. Cabrera says they've made the request with the feds to bring in medical personnel to help, but don't know yet when the cavalry will arrive.
Unfortunately, we don't have a set date, and it takes about 14 days. The reality is that when they do come, it's a commitment for about 30 days. And regardless of where we are in this curve, even if we start on a downward trend, which we pray we do, that our current staff they definitely need respite, and that this staffing will help provide that as well.
The request has to go through FEMA first, and they would arrange for the military medical personnel. He says they spoke again just today with a regional office.
They definitely understand the urgency here. They are quite concerned for Guam. They're seeing this, that our rate of increased cases is similar to Navajo Nation, and that's been widely known of how dire things have gone there.
The Navajo Nation he refers to, according to national media reports, it has a population of about 173,000 and more than 4,000 cases, the highest per capita rate in the country. For Guam's News Network, I'm Nestor Lecanto.
Brought to you by GTA. We start with you.